Herb had a keen sense of where the most opportunities for breakthroughs in understanding mental health were coming from.
The breadth of his impact was truly breathtaking. It is remarkable the range of things that Herb had a hand in. Everything from bringing together New York Hospital and New York Presbyterian to form New York Presbyterian, to being the director of the National Institute of Mental Health and his work with the Brain and Behavior Research Foundation.
With her Pardes, what we are celebrating is probably a singular example of how to be great in our field.
Herb was looking for progress in psychiatry that was beyond incremental progress.
Herb's thinking was truly visionary.
What he did was make mental illness and the treatment of mental illness the concern of the entire medical profession, the concern of legislators, of philanthropic supporters.
His core concern was about the suffering of patients with mental disorders. And he kept the mission focused on serious mental illness and never sugarcoated it.
I wanted to see a reduction in the prevailing tension between patients, families, and psychiatrists. That tension was in part precipitated by outdated hypotheses in the psychiatric community. The idea that major psychiatric illness was simply the responsibility and fault of parents.
He has been called a giant in the field, a pioneer, and clearly he was all of those things. In addition, though, he was also a wonderful human being.
Herb brought neuroscience, which was a new field at the time, into the study of mental illness. And that was an exciting advance for psychiatry.
What Herb realized, which is true now more than ever, is the best way to reduce stigma is research.
BBRF has lost an extraordinary leader, a visionary, and most importantly, a person who cared so deeply about the mission of BBRF.
We've lost a great figure in our history.
When the history books of BBRF are written, they will say that not only did Herb begin BBRF, but through his leadership and vision, he was able to bring BBRF to where it is today.
How you feel is something happening in your brain. How you think is something happening in your brain. And Steve Lieber, Connie Lieber, and Herb Pardes understood this. And they felt that the more the public can be informed about what research could tell us about these illnesses, the less stigma there would be as a result. And Herb Pardes is a big reason that that's happened.
The goal is simple: to enhance the productivity of the research, to find the advances in this field that will lead to improved care for psychiatric patients and their families.
BBRF was a central thing in Herb's mission, which was twofold: to fund young investigators and to disseminate research in psychiatry across the country, across the world, because he felt that that was the best way to help patients with these very damaging illnesses.
Connie and Steve and Herb saw the benefit of taking a risk, a careful risk, on new and innovative ideas that may work, may not work, but many of them did.
He transformed BBRF from a typical patient-oriented foundation to one that became the #1 mental health foundation in this country. He brought together our entire field to help. If you look at the Scientific Council, every leader in our field is a part of that scientific council.
He loved the idea that he was able to collect some 200 of the top investigators in mental health research that decided on which awards were going to be given. Awards for seminal research, for seminal contributions to the field, eventually for humanitarian contributions to the field.
Once you were elected to the council, you got a personal phone call from Herb Pardes. You pick up the phone and he says, "This is Herb Pardes," and you think, whoa, wow, and welcome to the Scientific Council.
Under Herb's leadership, BBRF has played a unique and extremely important role in bringing young scientists with new ideas into psychiatry.
We often overlook how we need to really get people going and to sustain them. And that's what I think BBRF has done through its Young Investigator program. I think he saw the young investigator as the future of the field.
What would have happened if those grants had never been awarded and the careers of these thousands of scientists had not been fully realized? What would the cost of that have been to progress in psychiatry?
What we've all lost with Herb Pardes is a voice to help people understand that mental health and mental illness are the concerns of the entire world.
I think that for families of individuals who suffer from mental illness, it's important to know how critical highly visible champions are for making a difference.
Families and patients suffering from mental illness will know that Herb Pardes was on their side and that his memory will be on their side.
I think we lost a pioneer.
He's a great man, and we will miss him greatly.
Another Herb Pardes might never come along again.
I think that as we move forward, we will always think about how Herb would approach a certain issue or problem or challenge and try to, as best as possible, follow that guidance.
Our intention is to keep fighting, that we develop treatments that provide the most profound relief from psychiatric symptoms and all the dysfunction that psychiatric illness causes. I want to thank you and just say, let's keep going forward.